In addition, you have the payers or insurers. Their models are changing. So first and foremost, there's decrease in a lot of reimbursements, and we'll talk a little bit more about that on another slide. And there's also uncertainty in terms of what is reimbursement going to be. And then in regards to payment reform, like I said, fee-for-service is not going to be the model for the future. So before you had good volume, you were doing okay. Now it's going to be about what's the quality of your care. So the more you're able to have the appropriate quality metrics, you'll be compensated appropriately with incentive payments. In addition, there are bundled payments to make sure, again, they're effective solutions and protocols being implemented in the patient care. Finally, on this slide, and we were just talking, I was talking with one of the doctors as to ICD-10 and the havoc that's creating. It's already been pushed out 1 year after the next, and now it's planned for this fall to be rolled out. But there's a lot of anticipation as to what's going to happen on the health system side as well as on the practitioner side in terms of reimbursements. And there's much talk about 20, 30% shortfalls in that first conversion year because of the lack of clarity as how it's coming to the market. The insurers are also doing a lot of work around the risk sharing model. So I'm sure all of you have heard about accountable care organizations. There are 3 main types, the last of which was just rolled out here recently by the government, the next generation ACO program. But the Pioneer program was a program that I think even some of you were involved with starting here in the state of Michigan. Was a program where you were sharing on the downside as well as on the upside, but fully on both sides. So there was good if you were doing well, but if you weren't doing well, which unfortunately most of them did not do well, there were great losses there. On the shared savings program, this was a mitigated model in which the downside you were not affected by, but the upside you were sharing after a certain threshold, 50-50 with the government. And then most recently, the next generation ACO, which is just coming to market, is it's coming to market in such a fashion that those that have provided good savings the first few years of their program, they're still able to benefit from their baseline. So it's kind of a risk-adjusted model. The interesting thing about this is you'll see the tremendous growth here in the chart here in regards to the number of ACOs. So as of early this year, we're over 600 ACOs. And if you see the breakout as to by type, the physician group model is definitely leading the way. So as of this chart, there are 260 physician-led ACOs in place. Now, that matters, and that should be important to you because you as physicians are really at the heart of the solution. And I think we have one of the private physician-led ACOs. We have a couple individuals that actually have started and lead some of those. They can tell you the reason why it's popular is because the doctors are the ones that can really impact the change the most because they're on the ground, they're interacting with the patients, they understand how things coordinate with the health system, they understand what the insurers have to do with it. So they really have a good position in the landscape if they understand their role in it and they actually leverage that role to create an effective change that's positive for the whole system.